Most people prefer to remain at home when they become sick or disabled. The fast-growing field of home care helps older adults and those with physical or developmental disabilities remain in their own homes. When you work in home care, you become part of a team. The home care team is a group of healthcare professionals assigned to care for a particular individual. How the home care team is created. Each client has particular healthcare needs. Members of the home care team are assigned to service the specific needs of each client. Professionals who may be members of the home care team include the physician, registered nurse, physical therapist, and occupational therapist. Other home care team members include the social worker, speech therapist, home health aide, personal care attendant, homemaker companion, and the primary family caregiver. The physician or medical doctor is at the head of the home care team. He or she authorizes home care treatment and oversees the plan of care. A registered nurse evaluates the client's condition and provides skilled care such as treatments, assessments, and medications. The RN supervises the nurse's aide, home health aide, or other caregivers. A physical therapist assesses the client's physical abilities and develops a treatment plan to restore function and prevent disability. The physical therapist teaches and assists the client in carrying out appropriate exercises. The occupational therapist assesses the client's ability to perform essential daily living tasks, including bathing, dressing, and cooking. An occupational therapist works with the client to improve skills and abilities. The social worker evaluates the social and psychological situation of the client and family. Social workers help the client and family to cope with problems and plan for the future. They also help identify available community resources. A speech therapist evaluates the client's speech and language. The speech therapist teaches the client exercises for tongue, mouth, and face, and treats speech or swallowing disorders caused by physical illness or mental conditions. The home health aide is a certified nurse's aide who provides personal care under the direction of the RN. He or she may also assist with rehabilitation activities under the direction of a physical therapist. The in-home care provider. Job titles for this category of worker vary from state to state. Titles include direct care workers, personal care attendants or aides, home care aides or nurses' aides. The in-home care provider provides personal care such as bathing, oral hygiene, and dressing. Homemaker companions provide non-medical care, performing household duties such as laundry, cooking, and light housekeeping. Other responsibilities include maintenance of safety, transportation, and companionship. Ongoing education helps to develop and refine caregiving, communication, and professional skills, and increases overall understanding. Continued learning leads to better care and greater job satisfaction. In order to provide quality home care, it's important for members of the home care team to work together in a professional, cooperative way. Fulfilling the care plan. The care plan describes the person's health issues and physical limitations. The care plan describes short and long-term goals for each problem area and describes methods that each member of the care team must use to meet those goals. Everyone involved in the patient's care follows the care plan. Following care plan instructions exactly provides a consistent standard for each task. You may be required to learn new ways to perform common caregiving and household tasks. Follow the instructions you are given, even if they are different from the way you are used to doing a task. If instructions are confusing or seem to conflict, be sure to ask questions and check with your supervisor for clarity. The benefits of following instructions carefully: it shows that you are doing your part to fulfill the care plan. It protects you from liability issues. Developing good observation skills. Use all your senses. Use your eyes to check the home environment for safety and cleanliness. Use your senses to notice daily changes in your client's skin color, mood, pain levels, appetite, and sleep patterns. By staying alert and using all your senses, you will develop good observation skills. Reporting to your supervisor. Report any changes in your client's physical or emotional condition to your supervisor. It is always better to report an observation, even if it seems unimportant or you are unsure about it, than to risk the client's well-being by not reporting it. These events must be reported immediately. Falls, deep wounds, chest pain or pressure in the chest, severe bleeding, slurred speech, difficulty breathing, seizures, severe pain or pressure in the abdomen. Documentation describes your observations and activities and becomes part of your client's legal record. Your agency will provide documentation forms, tell you how often to provide written documentation, and where and when to turn it in. Good documentation should be factual, descriptive, objective, brief, easy to read and understand. Each entry should be dated and signed. Important elements for success on the job. When you work in the home setting with clients and their families, you are entering a place that most people consider to be very private. Your positive attitude can decrease any stress your client feels about having a stranger in their home. Here are some guidelines about positive attitude. Be pleasant with a polite demeanor. Have a caring, service-oriented attitude. Be flexible in terms of schedule. Respect and accept the values and beliefs of your client and family. Behaviors to avoid: being judgmental, giving advice, bringing up controversial or upsetting topics, discussing your own problems, talking down to your client, moodiness, and gossip. Your client and family rely upon you, so attendance and timeliness are especially important. If you are unable to report to work because of illness or emergency, contact your agency as soon as possible. Smoking is discouraged. If smoking must occur, it should be done outside and restricted to break times. Hygiene and grooming. Wear modest, clean clothing, or a uniform if required. Hair should be neat and pulled back. Keep fingernails short and natural. Bathe daily and use deodorant. Wear minimal jewelry. Wear comfortable shoes with a non-skid sole. Telephone use should be restricted to job-related calls, such as reporting to the agency or another member of the healthcare team. Never use the client's household phone for any personal calls. Restrict personal calls to lunch or break times outside the client's home. Personal visits with family or friends should not occur while working in the client's home or when at the agency office. When personal problems are brought into the workplace, it affects everyone's mood. A positive atmosphere is especially important when caring for those whose health is fragile. Leave personal problems at home. Home care can be physically and emotionally demanding. Take care of your own health through exercise, relaxation, and activities that give you pleasure. The services you provide are vital to the health and well-being of your client. Your contribution is an essential part of fulfilling the care plan.